Hello, my name is Fiorella Diaz, and I'm going to talk about embolization of struts from an inferior vena cava filter. Definition: embolization is a procedure that uses particles, such as tiny gelatin sponges or beads, to block a blood vessel. Embolization may be used to stop bleeding or to block the flow of blood to a tumor. Inferior vena cava filter is a medical device placed in patients with proven pulmonary embolism or those with risk of embolization. Although many IVC filters are designed for removal after patient recovery, in many instances they are never retrieved. Here's a video that explains what an embolization is.
Embolization is the technique of blocking abnormal blood vessels. There are several ways to block a vessel. We could use particles, liquid agents like glues, or special coils. Embolization is indicated to block a vessel that is bleeding after maybe an accident. It could be used to reduce the blood supply of a tumor before surgery. It also finds use in the treatment of abnormal clusters of blood vessels. For example, in a case that is bleeding from the intestine, a tube is first taken from a puncture made in a blood vessel of the leg into the blood vessel close to the point that is bleeding. This is done under image guidance. Then through this we pass another smaller tube so that we can reach the very site that is bleeding. Then we use multiple platinum coils to block the vessel, curing the patient or stabilizing the patient completely. Embolization is a revolutionary technique which can be life-saving in several situations. It is performed under local anesthesia, and often the patient can be discharged in a day or two.
IVC filter. Inferior vena cava filters were developed with the intent of preventing pulmonary embolism and reducing venous thromboembolism-related mortality. Nonetheless, IVCF are not devoid of complication. Serious complications such as IVC thrombosis occur in a non-negligible proportion of patients receiving these devices. More so in several high-risk populations, such as metastatic cancer patients. Nonetheless, in modern practice, these devices are inserted for multiple indications ranging from prophylaxis in high-risk patients to prevention of recurrent VTE in patients who cannot receive anticoagulation due to an acute bleed or need for surgery. Here's a video of an inferior vena cava filter procedure. Now for the pros and cons. For the pros, the filter catches blood clots and stops them from moving up to the heart and lungs. This helps to prevent a pulmonary embolism. And for the cons, there's an increased risk of subsequent DVT, filter migration embolization, and IVC stenosis or occlusion. Application in Ecuador. In Ecuador, there is a medical center specialized in cardiological problems where they perform this type of procedure. Conclusion. An important information is that inferior vena cava filters are widely used for prevention of pulmonary embolism. The filters appear to reduce the risk of subsequent PE, but increase the risk for DVT, and have no significant effect on overall mortality. Now here's another video of IVC filters.
What are IVC filters? The inferior vena cava is the largest vein in the body. It carries deoxygenated blood from the lower extremities to the right atrium of the heart and then to the lungs. An inferior vena cava filter, or IVC filter, is a small cone-shaped device that's implanted into the inferior vena cava just below the kidneys. Why are IVC filters used? IVC filters are placed to prevent blood clots in certain patients. The filter is designed to capture blood clots that break loose from one of the deep veins in the legs and travel to the heart and lungs. What are the side effects or common problems associated with IVC filter use? There's a growing body of clinical evidence regarding the association between inferior vena cava, IVC filters, and life-threatening health complications, even going so far as to question whether trauma patients really benefit from having these implants placed at all. A patient can experience IVC filter fracture and migration symptoms as blood loss, extreme chest pain, breathing issues, or puncturing of veins, organs, or tissues. Filter implantation side effects can include device-related death, device migration, filter embolization, filter break, insertion site thrombosis, perforation of the inferior right vena cava, recurrent deep venous thrombosis, DVT, recurrent pulmonary embolism, PE, surgery to remove the device, thrombotic issues. What is the status of the litigation? The first lawsuits were filed against Bard in California and Pennsylvania state courts in 2012. In October 2014, the U.S. Judicial Panel on Multi-District Litigation, JPML, consolidated lawsuits against Cook from 11 districts to an MDL in the Southern District of Indiana. In February 2015, C.R. Bard settled an IVC filter side effects lawsuit 10 days after the trial began. The JPML consolidated lawsuits against Bard in the District of Arizona in August 2015. Currently, this means that there are 2 large multi-district litigations and a number of lawsuits that are still pending in federal and state courts.